Hi, I'm Dr. Vijendra of the Healing Zone. This video, we are going to examine what are the characteristics or hallmarks of cancer. Very often, cancer is described as a collection of 100 or 200 different diseases because it arises in different organs and different tissues. But considering these cancer cells happen in a whole bunch of different tissues all over the body, they share some amazing characteristics which are very similar. And this is important because it tells us something very useful that we will need to think as we look at what treatments can be used for this cancer. What it means is when a normal cell becomes a cancer cell, it starts to exhibit this whole bunch of different activities. For instance, there is sustained proliferating signal. All cells require growth signals to tell them, yes, okay, you should grow now. But at the same time, once a certain growth is achieved, just like, we don't keep growing until we are 20 feet. We stop at a certain predetermined biological coordinate. Similarly, cells should switch off those growth signals. Unfortunately, in cancer, the signal keeps playing on and on. So that is what keeps the cells dividing and continuing to multiply. And additionally, those factors which are meant to suppress growth, cancer cells are able to evade those suppressive factors too. Our body is designed to be able to detect and destroy cancer cells. But provided our immune system can recognize a particular cell as being cancerous. But cancer cells are actually pretty smart cells, that they develop certain ability to evade the immune system by cloaking themselves with proteins that makes them not seen by the immune system, or they produce chemicals that disable certain pathways of the immune activating systems. So this is another characteristic. They keep dividing and they refuse to die. So this is a problem. When cells do not die, it keeps forming a growth, larger and larger. And they also develop ability to both create inflammation, and the damage it causes in surrounding tissue also causes inflammation. This again promotes new tumor formation. Now, we saw in an earlier presentation that cancer cells are able to break away from their clusters and metastasize. They can break away and invade nearby tissue, but they can also move to organs far away by moving within blood vessels or lymphatic systems. Now, as the cell or tissue grows bigger and bigger, obviously they need more blood supply. They achieve this by inducing angiogenesis or making new blood vessels. Because of this rapid growth, because of lack of blood supply, they develop genome, or the genetic material becomes very unstable, making them very prone to multiple genetic defects, mutations. as we mentioned just now, they are able to evade the death signals. All cells possess what we call a programmed cell death function. But cancer cells appear to be able to resist this cell death function. And this is a very clever adaptation. The cancer cell starts to shift its energy production from an oxygen-based metabolism to a non-oxygen-based metabolism. So what we find is that irrespective of where the cancer arises, they share these common traits. These common traits are similar to all cancer cells. What it means is the development of cancer is not a random process, but it happens in a very clearly planned fashion. So the transformation of a normal cell to a cancer cell is actually a very clever adaptation once the cell has been damaged. This is important because there is now an opportunity, by dealing with the root causes of those cancer and addressing these various factors, that we can reverse the cell behavior to a normal cell. And this is important as we try to heal cancers. And I hope that information will help you in your journey to fight this cancer. Thank you.